Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. If you are a woman and you're suffering from symptoms like acne on the face, infertility, or you're feeling tired all the time, your doctor may have advised something called the DHEA-S test or the DHEA test, and today I'm going to tell you everything about this simple blood test. So what is the DHEA-S? Well, this is basically a hormone. It's produced in your body by something called the adrenal gland. These are two tiny structures present above each of your kidneys, one on either side. The full form of DHEA-S is Dehydroepiandrosterone Sulfate. Now this is a pretty long name, but the main function of this hormone is basically it goes forward and creates testosterone and later estrogen. So it's what we call a precursor. That means it is something in the chain of hormone production. The main job is basically proper development of your sexual characteristics, puberty and maturity. So what are some conditions that your doctor might be thinking that you have because of which they asked you to get this test? So there are three main conditions. The first one is that the doctor might be looking for a cancer. Sometimes there are cancers which produce a high level of this hormone. That's one cause. The second one is a situation in which these glands which produce this hormone are overacting for some reason. We call this hyperplasia or hyperactivity of the adrenal glands. This is another condition in which we see this. And the third is in young adults, if you have had very early puberty, that's another situation in which your doctor might be wondering whether there is a high level of this hormone, and so they have advised this test. So what are some of the symptoms that you would experience as a woman if your DHEA-S level was not normal? So there are all kinds of symptoms. I've given you a list over here, so I'm going to talk about a few of them. Acne or oily skin is probably the most common of them. Secondly is hair fall. You might lose hair from your scalp, from the top of your head or from the front of your head. You may also have hair growth on other parts of your body where it shouldn't normally be there. Irregular periods or menstrual irregularities, irregular cycles, this is very common. Weight gain. You might also find that your voice is deepening, it's becoming like that of a man. Your Adam's apple size may be growing. All these are signs of an increased level of DHEA-S in your blood. What are the symptoms of an abnormal DHEA-S level if you're a man? Well, in most cases, the DHEA-S may show no symptoms in men even if its value is above normal. But in some cases, we may see symptoms like low energy, overgrowth of the breasts, or you might also find that there is very early puberty. These are the only signs that we might see in men. So how is the DHEA-S test done? Well, this is a simple blood test. All you need to do is provide a single sample of your blood. There is no need to fast before this test, although some labs may ask you to fast for 8 to 12 hours. The sample can be taken at any time of the day because DHEA-S is unique in that its levels don't change with the time of the day. You will usually have the results within 1 to 2 days. The unit of measurement, that is the number that you will receive, its unit will be Ng per ml, and the department of your hospital or the lab in which this is processed is called the immunoassay department. So what is a normal level of the DHEA-S for men or for women? Well, what we normally find is that especially in men, these levels rise all the way till they are between 19 to 30 years of age. That's when we find the highest levels, and thereafter the levels tend to drop again. I've included a complete list of the normal ranges over here. You can take a look. But what is important to note is that this is a hormone which basically produces the male sexual characteristics, and so it will change with age. What are some causes because of which your DHEA-S level may be high? So there are three main reasons. The first is a cancer in the adrenal glands which is producing too much of this hormone. The second can be a situation in which these adrenal glands have grown in size, and this is causing them to produce more of these hormones than usual. The third could be medications. There are medications that you could take for diabetes or for heart problems because of which this level may be affected. In children, the cause is just one. When you have very early puberty, this is early development of your sexual characteristics is one of the main reasons because of which this hormone level might be high, and that's what the doctors will check for. If you are looking for the price of the DHEA-S test, especially in India and in Pune, well, in our lab in Pune, we charge around rupees 1100 for this test.